As a foreign medical graduate coming back to Nigeria, the biggest hurdle you'll come across will be the MDCN examination. Hi, my name is Dr. Mariam. If you're new to my channel, subscribe. I make videos to help junior doctors navigate easily through the medical system, which is why you're here, right? Today we're going to talk about MDCN examination. The trauma. To practice in Nigeria as a clinician, you're going to need the MDCN license or the Medical and Dental Council of Nigeria license. This comes automatically if you graduate from an accredited Nigerian medical school. But if you studied outside of Nigeria, like the rest of us, then you have to go through the very unpleasant experience of writing the MDCN examination. So if you're unfamiliar with what the MDCN is, I have an in-depth video explaining everything you need to know about the exam itself. So if you have not watched that, I highly advise that you pause this video, go ahead and watch that, and then come back to this video after you've finished watching that. I think we can all agree on that just hearing MDCN triggers a lot of PTSD for foreign medical graduates. The exam is notorious for its failure rate. I don't have the exact specifics, but there have been multiple occasions whereby the pass rate has actually been less than 50%. And because of this, a lot of people actually pass the exam on their subsequent attempts rather than the first one. So today I'm going to be sharing with you some tips and my experience, hopefully to get you in the best shape possible for the examination. So the examination is carried out over 2 days. The first day is the CBT, which stands for computer-based test, and then the second day is the osce. The CBT is the easiest part of the examination in my opinion because it's very objective. It's just you and the test. There is no third party to determine whether or not you deserve marks based on what you say, what you do, or how you do or say it. What you know is what you know. Plus the MCQs are very basic. If you didn't slack in medical school, you really shouldn't have a problem with the CBT. The picture test isn't too terrible either. They ask about pretty basic things like pictures of pathologies, drugs, instruments, and then they ask questions based on said pictures. But disclaimer, some of the pictures might not be very clear, so don't say you haven't been warned. So the osce, the osce, in my opinion, is where most people fumble up, not because they don't know what they're doing, but because they're used to a significantly different system from what's being done here. For me personally, the challenge I encountered when I returned back to Nigeria was adapting to the system here. So for example, the sequence of examination that I learned was completely different from what was expected of me for the exam. For example, for cardiovascular examination, how I learned it was starting from the hands, to the face, to the neck, and to the precordium. But here the system was a bit different. And I have physical examination videos, so make sure you watch those. Another thing that was different is that here there's no running commentary during the exam, and then emphasis was heavily placed on showmanship, not what you know. For the clerking or history taking, again, I was really thrown off because the system that I was used to was also different from what was being done here. For example, how I learned it was presenting complaint, history of presenting complaint, and then you just characterize it however makes sense, and then you move on. But here, for the history of presenting complaint, there are like the 4 C's, or is it 5 C's? I'll make videos on that for the clerking. So the history taking is significantly different as well. And because of that, I had to completely throw whatever I learned back in medical school out the window and relearn the Nigerian way of clerking, which in my opinion heavily relied on memorization. No joke, like you actually had to memorize the questions to ask. If not, you lose marks. In terms of what to study, the key is to not study hard, but to study smart, guys. So for the CBT, because it's mostly clinical questions and you just graduated from medical school, you just wrote your final exam. For me, what I did and what I found was like a shortcut was just going through my university lectures and then supplementing all that information with the information given here in Nigeria. For example, where I trained, we didn't really have emphasis on like malaria and everything, so I just read my uni lectures and then supplemented the reading here using these books. So for the CBT part of the examination, like I said, I used my uni lectures and then supplemented my reading. So for the supplementation, you really do not need advanced books, and I really do not advise anybody to venture out of these books. So that's the guide, rule of thumb, and synopsis. Most of the information in these books is the same, so you just have to pick which book is best for you and then just go with it. Most people use the guide to study. It's very comprehensive, very summarized, and just it's very focused. It has all the topics that you need to know. So I really do not recommend you going through and reading something outside of this because you'll just be wasting your time. The guide comes in 4 books. It comes in obstetrics, surgery, medicine, and pediatrics. And then you have other books like Rule of Thumb and then Synopsis. So most of the information is similar between these three books. So it's just really up to you to pick which one you want and just go with it. But usually just limit yourself to either Synopsis, Rule of Thumb, and then the guide, which is what most people use. Personally, I preferred Rule of Thumb because it was more clear, and then the book just feels like it's more qualitative. If you read inside, the pages are more clear, the writing is more clear and everything. The only disadvantage is that Rule of Thumb, to my knowledge, comes only in obstetrics and pediatrics. So that's the only problem with that. Like I said, for the CBT part, I really just read my university lectures because all the information was fresh in my mind. So revision was much easier. And then I supplemented with these books. And I really really do not advise anybody to go and get one advanced book and start wasting your time with these books. They're all you need, honestly. I'll try to gather the e-formats of these books so that I can link them in the description below. That way you can get access to all that information without having to physically go out and look for them. So for the picture test, right? Very important here as well. We're coming back to our books. Do not ignore the end of these books, the guide. Really do not joke with these pictures, guys, especially for O1G and for surgery. I have seen pictures in the exam that I came back and I found in these books. So for the picture test, I would really advise you to not skip the back of these books, especially surgery and O1G. For medicine, it's just medicine. And then for pediatrics, there's this book called Pediatrics in Pictures. I really love this book. Like, it's so nice to read, it's straight to the point, and it has most of the pathologies inside. So to summarize, for the picture test, go through the back of the guide. It has a lot of pictures there for O1G, surgery, medicine, pediatrics. Go through them. And then for pediatrics, you need this book. So I seem to have lost the guide and synopsis for pediatrics. It's always pediatrics. How did I lose two books at the same time? Anyway, these books, get them, memorize them, soak them in. They're indispensable for the examination. And now for the OSCE. So for the OSCE, the exam has its bread and butter things that they repeat year after year. Number 1, level of prevention. It always comes out. Always. Number 2 is your symptomatology. So this is where they give like a brief history and then 3 symptoms, and then they ask you to list 10 symptoms in each of the systems that can be affected. So for example, they give you a scenario of a person who comes with cough, shortness of breath, and body swelling, and then they'll ask you to list 10 symptoms from each of the possible systems that can be affected. So for example, a person who comes with cough, shortness of breath, and body swelling, the system affected can be cardiovascular, it can be respiratory, and it can be renal. So you will be expected to list 10 symptoms in cardiovascular system, 10 symptoms in respiratory system, and then 10 symptoms in the renal system. This comes out almost every year as well. Number 3 is your physical examination. This guaranteed you will have at least 2 stations, if not more, of physical examination. And for physical examination, watch my MDCN series for physical examination. I've done all the examinations that they usually ask in MDCN. Number 4 is history taking, or as they like to refer it here as clerking. So for clerking, there's a book called Clerkship Secrets. I don't have the physical copy, but I have the e-version. So I'll try to find a way to link them in the description below so that you can get access to all the materials. So for history taking in MDCN, Clerkship Secrets is vital because it has, first of all, the format of history taking that they use in Nigeria, and then it has different scenarios, different presenting complaints, and the specific questions to ask for those presenting complaints. Number 5 is counseling. Counseling always comes out as well. And then number 6 is lab interpretation. This is just interpreting a test result. For example, you can have a food block count, LFT, ABG. For us, I think we had NFT to interpret. It's usually pretty basic and straight to the point. It shouldn't be that difficult. For MDCN examination, I can't emphasize enough the importance of familiarizing yourself with how things are done here. For example, you might examine a patient correctly but in the wrong sequence, or take a history and reach a diagnosis but you didn't ask the specific questions that they wanted you to ask. Or you might do your level of prevention the conventional way you were taught, like the primordial, primary, secondary, tertiary, which isn't the format they use here. My point is you have to go into this examination with the mindset that the examiners are expecting specific things from you. It doesn't matter if you do it correctly. If you don't do it their way, it's not the right way. So in terms of tutorials, right? Back in the past, MDCN used to organize remedial course for like 3 months, where candidates go to wherever location the exam is being held. They spend 3 months doing clinical rotations, getting lectures, and then at the end of the course they'll write the examination. But currently MDCN has scrapped that, even though there's some talk that they want to bring it back. But as of right now, nothing has been set in stone. So currently people just go to private tutorials or hospital attachments. During my MDCN examination, I attended NITMET tutorials and then National Hospital remedial course. Were they useful? Not really. To be honest, like for this examination, it's entirely up to you. You can do your reading solo and still pass the examination as long as you know what to study and what the examiners are looking for. But also, it doesn't hurt if you join any of the tutorials, because these people are familiar with the MDCN examination, so they are a good guide for you to follow for the examination. Another advantage of joining these tutorials is that you meet your peers and then you can form study groups, which really helps in passing the examination, because who else are you going to practice physical examination on? Who else are you going to do history taking on? So it's really important to have group studies, even if you're not joining any hospital or any tutorial group. For me, like I said, I joined NITMED, but most of my friends joined ACE Medics, and I hear good things about that, so you might want to consider that if you're in Abuja. And then for hospital attachments, it really didn't help much. I went to Wuse first, Wuse District Hospital. It was absolutely horrible, and then I moved to National Hospital. It was okay, but for me, to be honest, the clinical tutorials are more important than hospital attachments. But at the end of the day, how you want to utilize your time before the exam is entirely up to you. So before we end this video, I want to clear a misconception. Failing the MDCN examination does not mean you're not smart enough or not good enough. I know a lot of smart people that wrote this examination and bugged. Not because they weren't smart, because they were really smart, but because they did not understand that the MDCN examination, unlike PLAB or USMLE, is one instance where your clinical acumen will not save you. If you do not do it the MDCN way, it's not the right way, even if it's correct. Personally, when I wrote this exam, I did not feel like my knowledge was being tested. Why? Because I had to memorize everything, go into the exam and pour it out. It felt to me like a test of memorization and ability to regurgitate all the information you learned with a sprinkle of showmanship skills. In other words, you don't have to know what you're doing, you just have to look like you know what you're doing. So in conclusion, although the failure rate is very high, passing the examination is not an impossible task. It's not about knowledge or clinical experience like I've been trying to hammer into you for the past few minutes. It's about showmanship and memorization skills. Read the recommended books, familiarize yourself with the system, meaning the physical examination, the history taking, the clerking, the counseling, everything. You have to familiarize yourself with the way things are done here. You have to give them what they want, not what you learned, even if it's correct. Again, I emphasize that. So we've reached the end of our video. Hopefully, I gave you a little bit of wisdom and something to help you best prepare for the examination. Make sure to watch my clinical examination videos. I'll also try to make counseling videos, clerking videos, as well as public health videos like the levels of prevention. So I have plans for all that. If you liked anything I had to say or learned anything from this video, please leave me a like. If you have any question, leave it in the comment section below. Thank you for watching.